धन्वन्तरिमादिदेव सुरासुरैकवन्दितपादपद्मम् लोके जरारोगभयमृत्युनाशम् दातारमीशं विविधौषधीनाम् शङ्खं चक्रं जलौका दधतमृतघटम् चारुदुर्भिः चतुर्भिः सूक्ष्मस्वच्छान्निरुद्धम् शुकपरिविलसनम् मौलिनं भोजनेत्रम् कालाम्भोजोज्ज्वलाङ्गम् कटितटविलसनम् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिन्दम् निखिलगदवदन् प्रौढदावाग्निनीलम् प्रौढदावाग्निनीलम् प्रौढदावाग्निनीलम्.
Good morning to you all. SMBT Educational Trust was established in the year of 1984 with a vision to provide higher technical, medical education and quality healthcare services to help ailing people in need through its multi-specialized charitable hospital. Our goal is to make SMBT the most respected and trusted group of the institutions in the field of healthcare education, healthcare training and healthcare delivery. SMBT Trust has been growing since day one. It has developed and worked on strategic plans and methods to educate students and provide cost-effective medical care to ailing. With that being said, today SMBT has successfully branched out and established more number of schools, institutions and hospitals. Nasik is really known for its nature and healthy weather. We are surrounded by the Sahyadri mountains that provide us natural Ayurveda herbal medicinal plants. Because we are in the nature's lab, we started the Ayurvedic Institute in the year of 2007. In our institute, we offer UG courses, that is BMS, and 36 seats for PG, which are or in clinical subjects. And our experts have treated more than 1 lakh patients. The Trust has established 250-bedded Ayurvedic hospital. Our Ayurveda college is guided by Principal Dr. Pradeep Bhabat sir. We also provide food and hostel facilities for students that are on par with the quality standards required. On behalf of my institute, I would like to invite you all to visit my college campus and experience the learning and service that is provided to our people. Thank you. Am I audible?
त्याचा ऑडिओ बंद कर मग त्याचा ऑडिओ चालू आहे.
व्हिडिओ स्टार्ट करू. Hello, sir. Am I audible?
Yeah, अभी आवाज आ रही है.
Am I audible? No.
Now I think I am audible.
Yes,
Hello?
yes.
येतोय?
Dr.
Good morning,
Vinaya.
sir.
Good morning. I am audible.
Okay, sir.
Good morning to everybody. Good morning, Varsne sir, Guruji.
हाँ नमस्ते नमस्ते.
Nice
Sorry,
meeting
sir,
again.
for inconveniences.
हाँ नमस्कार.
Okay, sir. Yes, sir. You are audible, sir. You are audible.
Yeah, thank you. From my side, I will take pardon, sir. आज मैं OPD में हूँ और OPD में से connected हूँ तो थोड़ा disturbance रहेगा.
Namaskar, sir. Vashne sir is also there, na? Yes, yes.
Yes, I am here.
Good morning, Vashne sir. Good morning.
नमस्ते नमस्ते.
Yes, sir. You are in OPD. We can see that. Yes, sir. Shall we start our program?
Varsne sir,
Yes sir.
Dr. Vinaya आपसे permission मांग रही है.
अरे बिल्कुल बिल्कुल
आप दोनों से परमिशन मांग रहे हैं सर.
अवश्य. चलिए बेस्ट विशेष स्टार्ट करिए.
Thank you. So, good morning everyone. Today we have 4 main sessions. First is announcement by Dr. Solanki sir about coming event in the progress of Ayurveda. Second is there were so many questions in our question box. We were about to answer them personally, of course, with the help of our expert speakers. But Dr. Solanki sir himself take initiative to answer the questions on this stage so that other people can also get the benefit of the information. The third session will be today's speaker, Dr. Shubhangi Bodole ma'am, and fourth will be winner of paper. And of course, last not but the least, Thanksgiving. So, Vashne sir and Dr. Solanki sir, may I start the questions, please?
Oh.
Sorry. Solanki sir, please give information about the event.
Dr. Shilpa madam, what I feel is we will start the question answer session so that who are the late joining people will be also benefited by my announcement. So at the end of question answer session, I'll be making announcements, whatever is required. If you,
Okay, sir. Actually,
you are
that
okay
means,
with that.
Actually, that means what I have done wrongly, actually it is right.
Yeah.
Yes, sir.
So have you completed Dhanvantari Stavan and everything?
Yes, sir.
Yes, completed the Dhanvantari Stavan and Institute introduction also.
Should we do it again, sir?
No. If you have done it and I'm joining late, I don't
Yes,
mind.
Yes, sir.
So we will straightway go for a discussion and question.
Question answer, sir. Yes. Sir, the first question I'm going to answer is from Dr. Ketki Zavade. She is a Ayurved practitioner. She said that when I heard your speech, sir, this is especially for you, sir, Solanki sir. When I heard your speech yesterday on Facebook Live, she was on Facebook Live. I got one question in mind, but before that,
I will like to congratulate SMBT as they have done this program with very much useful topics and with best speakers. Also, they took this program on Facebook Live, so and Twitter also. Many of my friends, she said that, who were unable to register have seen the program on that platform. Congratulate SMBT Shalya and hope you will come again and again with like this topics for Ayurveda people. I will just request you, it will be open for general physicians also. So thank you SMBT once again. Now her question is, sir, do we have any answer for the standardization of all our procedures practicing in OPD or IPD level?
Yeah, okay. Good morning, everybody. And thank you once again for inviting me today for whatever remaining question, answer, and participation in panel discussion. Dr. Bhabar, the principal of the institute, has just joined. I could see him on video. So good morning to him also. And thank you, Dr. Bhabar, for again participating in his program. Thank you very much. Another thing I wanted to add, Dr. Shilpa and Dr. Bhabar, is yesterday it simply slipped from my mind to appreciate the video of the institute you had shown yesterday with that drone camera and showing the all hilly region. It was such a scenario that I fall in love with the campus and the institute itself. Dr. Vinaya, you are at a very good place, and
Yes.
I congratulate for joining this institute. It was a good presentation in the beginning. Now, answering the question, today's question is, yes, there are attempts being made in this field that standard operative procedure for every Ayurveda procedure is being laid down, and we are planning to adopt it and implement it and strictly follow it. Especially, the principal must be aware of this fact that we are made compulsory for National Board of Hospital Accreditation, NABH, and this NABH is asking to strictly follow SOPs, and SOPs being laid down. There are so many Ayurveda procedures, especially Panchakarma procedures, which we Shalya Tantra people also follow for Rakta Mokshan, Agni Karma, etc., etc. The process is yet into being formed, and we are adapting those criterias, and Department of Ayush, Government of India has laid down, and it is there on their website also, and every institute is also having their SOPs regarding every procedure. We can do that, and by laying down these SOPs and implementing it, adapting it properly, we can go and standardize the things. In fact, in my opinion, it is very difficult to adapt and standardize each and everything, because right from evaluation, prakriti parikshan, to the dosh dushya, every perception differs from physician to surgeon. The concept differs, his perception differs, and it becomes little difficult, but no problem, we can standardize the procedures and adapt it. uh, what I said yesterday in my presentation is, this is the modern language, this is the language of the time. We need to speak, standardize, and document everything, because see, it's very difficult if when we say that we are doing Rakta Mokshan, and during Rakta Mokshan, there is a, if you do excessive Rakta Mokshan, it causes Vat Prakop. Can we quantify Vat Prakop? Can we quantify Pitta Prakop? No. It's very difficult. But we need to put our brain together. We need to study the Samhita, decipher the Sanskrit language, because somewhere deep down, these acharyas had laid down some criteria to quantify it. I think I take it in a way that I failed to understand, I failed to interpret, I failed to get the complete knowledge through the Samhita. And if we do that, if we decipher that knowledge, I think we will be able to quantify each and everything described in Ayurveda. And once it is done, we can standardize, and we may not be able to achieve 100% of it, but I think we can come nearer to it, standardize it, and adapt it. But I think this is a need of the time that we lay down standard operative procedure for each and every procedure we are adapting for, especially for Shalya Tantra. The way the modern surgery has done, we need to do that. It's a call of the time. Thank you.
Thank you, sir. Sir, our next question is
वार्षिक सर
from
ऐड करेंगे इस बारे में सर कि ये है बर्निंग इशू है एसओपी और स्टैंडर्डाइजेशन करना, जैसे कि सार सूत्र स्टैंडर्डाइजेशन का काम हो चुका है सर।
जी जी जी, आपने जो बोला बिल्कुल सही बात है, लेकिन धीरे धीरे लोग कर रहे हैं। अग्निकर्म के बारे में भी स्टैंडर्डाइजेशन हो रहा है धीरे धीरे, और रहा रक्त मोक्षण के बारे में तो अभी एकदम पैरामीटर जो है फिक्स तो नहीं हुए हैं जो आप बताए वैसे, लेकिन फिर भी क्लिनिकल ऑब्जर्वेशन इज द बेस्ट ऑब्जर्वेशन। जो आप लोग देखते हैं उसी से आप लोग डिसाइड करते हैं कि भाई क्या है, अदरवाइज बाकी चीजें डिफिकल्टी हैं अभी उनके स्टैंडर्डाइज करने में, लेकिन फिर भी क्लिनिकल सेंस इज बेस्ट, क्लिनिकल सेंस होना चाहिए।
Yes, sir. I think the must be satisfied with the answer. Our next question is from Dr. Rupali Diute. She is asking, does Viddha Karma and Viddhagni Karma is mentioned in Ayurveda? And she is asking again where I will get proper information about these procedures.
Yeah, the question is addressed to me or Varshney sir?
Sir, anyone?
Okay, तो पहले मैं बता देता हूँ, फिर
Yes, sir. Yes, sir.
वार्षिक सर उसमें ऐड करेंगे।
Yes, sir. Yes, sir.
अष्टविध शस्त्र कर्म में विद्ध कर्म का समावेश तो है ही है, और अग्नि कर्म ये पंचकर्म में एडॉप्टेड एक जो अदर प्रोसीजर्स हैं, शल्य के कर्मों में भी जो अनुशल्य कर्म है उसमें समावेश है। और मैं समझता हूँ डॉक्टर शुभांगी बदोले is going to talk on Agni Karma, and she might also comment on the Viddha Karma. So just wait till Dr. Shubhangi Badole completes her presentation. But Viddha Karma and Agni Karma, and now some experts have combined this to Viddhagni Karma. Yesterday in my speech, I had mentioned name of Dr. Uday Kulkarni, who is doing a great work in this field. Dr. Mahesh Sanghvi, he is also doing great work in this field of Viddhagni Karma. And pain management through Ayurveda. This is a very good program going around with in renewed format in last few years with the Viddhagni Karma. Viddhagni Karma is a very much part of the Sushruta Samhita described and Shalya Tantra also. And there are many more karmas now modified and formulated and coming into the practice. Varshney sir.
Yes, yes, you are right. As regarding Shalya Karma, Agni Karma, the especially mentioned for Mans and Asthi and Sandhi. So for that, the Viddha Agni Karma is a better way to give answer. The Viddha Karma help the deeper penetration of the heat. And I think this is how you can just explain about the Viddha Karma.
Yes, sir.
Yes,
Yes, sir. Thank you, sir.
Thank you, sir.
Then next question is directly mentioned for Dr. Varshney, sir, please.
Yeah.
Dr. Lalita Chaudhary has asked that Dr. Varshney, sir, explain about vertical and horizontal research in yesterday's lecture. Are we allowed to do them in our private practices also? Do we have some regulations and rules and regulations?
नहीं ऐसा कुछ भी नहीं है. Everybody can adopt the procedure, and horizontal vertical is a simple means. First you have done a random study, then you specialize in the topic, then how it acts, then everybody who is interested in Ayurvedic surgery or Ayurvedic field or Ayurvedic college can do this thing, and there is no problem about it.
Okay, sir. Shalya sir, do you like to add something?
Yeah.
Yes, sir.
Just 1 minute. चालू केलंय ना त्यांना सांग लक्षात ठेवायला. I'm sorry.
Yeah, no problem, sir.
Yeah, what Varshney sir correctly said is very much right. See, 20 years back, there were some staunch Ayurveda practitioners and followers. They said there is no need of research in Ayurveda. Ayurveda is complete. But no, we need to, as we said, there should be a text research. हमारे लिए थोड़ी difficult है because we are not language experts. So we need to decipher the meaning of text described into Samhita. Also, we need to work on some modern criteria in order to evaluate our own procedures described into Samhita. So we need to correlate. और ये ट्रेनिंग मॉडर्न की ट्रेनिंग हमारे विद्यार्थियों को देना जरूरी है। जो अभी झगड़ा चल रहा है या वाद चल रहा है हमारा, वो इसी पर है। आई थिंक मॉडर्न इन्वेस्टिगेशंस, मॉडर्न पैरामीटर्स, इनका स्टडी और इनका रिसर्च करके वो अमलगमेट करना, उनको इसके साथ जोड़ना, और हमारी आयुर्वेद की जो बातें कही गई है, जो स्वयं सिद्ध है, इस बात में कोई दुमत नहीं है। मैं संपूर्ण तरह उन लोगों से सहमत हूँ, those who are claiming that Ayurveda does not need research। लेकिन जैसा कि अभी बंबई में एक रिवर्स फार्माकोलॉजिकल रिसर्च सेंटर डॉक्टर अशोक वैद्य सर ने बहुत वर्षों पहले इस्टेब्लिश किया हुआ है। व्हाट वार्षणे सर उनका क्या बोलना है कि जैसे एलोपैथी में ये लोग एक फीवर की बात करते हैं समझो, तो फीवर पे उन्होंने एक एसिटिल सैलिसिलिक एसिड मॉलिक्यूल बनाया है जिससे पैरासीटामोल ड्रग इवॉल्व हुआ है। अभी हमारे पास गुडुचि रसायन ज्वरग्न कहा गया है, ये हमको पता है। नाउ दे आर वर्किंग रिवर्स फार्माकोलॉजी, दैट दे नो द ड्रग गुडुचि बट दे डोंट नो द एक्टिव इंग्रेडिएंट ऑफ गुडुचि। टिनोस्पोरा कार्डिफोलिया, they want to work reverse way. They want to work on Tinospora cardifolia. They want to isolate the active molecule in Tinospora cardifolia. And आयुर्वेद में नॉट ओनली गुरुचि ज्वरग्न बोला है, उसको रसायन भी बोला है। लेट डॉक्टर शरदिनी डहाणुकर मैडम का जो रिसर्च हुआ है टिनोस्पोरा कार्डियोफोलिया पर, उनका इंटरनेट पर पेपर भी प्रेजेंट है, जो पेपर को नेशनल अवार्ड मिला था, इंटरनेशनल अवार्ड मिला था। सेम वे एलोपैथी के बहुत अच्छे सर्जन हमारे महाराष्ट्र यूनिवर्सिटी ऑफ हेल्थ साइंसेज के वाइस चांसलर फेमस सर्जन केईएम के हैं, उन्होंने जलोका पर ये काम किया था। सेम वे रिवर्स फार्माकोलॉजिकल रिसर्च। सो लेटरल रिसर्च, वर्टिकल रिसर्च, रिवर्स फार्माकोलॉजिकल रिसर्च, हर तरह का काम होना चाहिए, तभी तो शास्त्र संपन्न होगा, मुझे लगता है।
थैंक यू सर। Sir, our next question is from Dr. Asmita Padvi. She is PG scholar. She is asking, does with reference to Shashti Upakrama, Basti Karma is included in parasurgical procedures that you yesterday told? That's why she is asking, I think. And in Shashti Upakrama, can we consider Basti as Vrana Basti and Kati Basti?
या
जी बोलिए सर।
नहीं, बिल्कुल कर सकते हैं, क्यों नहीं कर सकते। ब्रण बस्ती भी है उसी में, और तुम्हारा ये सब जितनी बस्तियां आती हैं, दे ऑल कैन बी टेकन इन पैरासर्जिकल मेजर, और द एनी मेजर व्हिच हेल्प इन द सर्जरी naturally will called as a parasurgical measure. If you are using the surgical disease and curing surgical disease by basti, naturally it will taken as a parasurgical.
Yes, Asmita, you can practice Varna Basti and Kati Basti as parasurgical procedures. Am I right, sir?
Yes, sir. Yes, madam.
Sir, now as I see in question box, Dr. Rekha Mukesh Rathi is asking, Solanki sir, please help. Is Marma Chikitsa is helpful in Parkinson's disease and how?
Repeat the question. I could not get it.
Difficult to say.
Marma Chikitsa is helpful in Parkinson's disease. If yes, how? How is it helpful?
As I told you, I attended this workshop for 1 week last year only, and I received few books on this. I had ordered few books also. I am in the process of studying it. That is number one.
Yes.
I had in my presentation said that Marma Chikitsa is very helpful in muscular, neuromuscular diseases. Parkinson is one such disease. Yes. Now, unfortunately, I fall into the Shalya discipline, and unfortunately, Parkinson patients do not come to me. They come to Kai Chikitsa department. So right now, I do not possess the experience of treating Parkinson's disease with Marma Chikitsa. We are treating as I said, cervical spondylitis, lumbar spondylitis, frozen shoulder, such kind of muscular and neuromuscular patients very much with the Marma Chikitsa. To be frank, I am into infancy of treating the patient with Marma Chikitsa. I am not yet expertise myself into that chikitsa. But yes, they are Dr. Shanmugam in Tamil Nadu and his assistant, they are treating Parkinson's patient. They had demonstrated how the marma massage, a particular sthapani marma or the marma situated into the shirasthan, and how they are doing the massage. What is the time duration of this massage? What is the time duration of pressurizing that marma point? They are working on it and they are curing the patient. So please do go and attend their workshop and have a good study on this. But I will not be able to answer your question to the extent that I am treating the Parkinson's patient. No, till date I have not treated any single Parkinson's patient with Marma Chikitsa, but I am already treating the cervical spondylitis, lumbar spondylitis, frozen shoulder patient, and I am keeping follow-up of this patient. When I will be ready with complete follow-up, cure or not cured, I will be presenting my paper on this.
Our next question is from Dr. Kiran Mantri, sir. He is asking your experience about Parshni-Shul treatment.
Yeah, Parshni-Shul, I can combine the modern terminology right from calcaneal spur to tendinitis to peritonitis to plantar fasciitis. काफी वार्षिक सर ये डिसीजेस है ना, they clinically present with Parshni-Shul. है ना, plantar fasciitis, tendinitis and calcaneal spur. And yes, we are treating such patient with Agni Karma, with Jalavakaucharan, स्थानिक रक्तमोक्षण with प्रक्षान कर्म और सिरावेद, इससे हम इनको ट्रीट कर रहे हैं and there are wonderful results. Even in calcaneal spur, the radiological appearance of the calcaneal spur is the diagnostic and patient gets symptomatic relief. 3 months, 6 months later, if you do the follow-up X-ray, calcaneal spur अपनी जगह बना है radiological evidence, but patient is relieved of symptoms which he is getting or he is getting after standing up or weight bearing or during walking, etc. But that thing is not reduced, that spur thing, but symptoms are reduced. Wonderful results are in plantar fasciitis, tendinitis, or bursitis also. The ankle region, the bursa comes, etc. In those results, in those diseases, I am getting the results. Maybe Varshne sir will add something to it.
Yes, sir. Varshne sir, please.
It is a very good, nice question. You will surprise a Sende madam from Pune. You might have heard the name. After 65 years of the age, she did PhD on Agni Karma, and she has treated so many cases of the Parshni-Shul by Agni Karma. If the person is interested to know about the detail of this person, so she can, the person can contact Dr. Sende madam from the Pune. She is doing camp on this Parshni-Shul only and getting great success. So it is a very good. Dr. Shalya has given the answer. We are not treating the X-ray or the other things. We are treating the patient, and complaint is relieved by Agni Karma. There is no doubt about it.
Yes. Thank you, sir. Varshne sir, there is a question. Actually, traditional question is Jaloka. Dr. Prashant Patel sir has asked it. If Jaloka Chikitsa is really useful in varicose veins?
Oh, good, very good question. Personally, I am against about the varicosity because it is an anatomical defect. The valvular defect cannot be corrected by any measure. But as regard the thrombophlebitis or deep vein thrombosis, the results are fantastic and very good result has been observed. But not as varicosity. I personally have no good result about the varicosity. But the complications of the varicose vein or varicosity definitely treated by leech application. I have treated so many venous ulcer, DVD, superficial thrombophlebitis, etc. So the results are good, but as regard the varicosity, it is difficult to say. Dr. Solanke can also share his experience.
Yes, sir. As you correctly said, sir, varicose veins have got an anatomical defect which cannot be corrected by treatment like bloodletting or Jalovkocharan, etc. But as Varshne sir said, where the complications of the varicosity has induced inflammation, there to reduce the inflammation, procedures like leech application can be very useful. In addition to that, sir, what I do is I advise the patients to do exercises where you have to lift up your leg and do the leg movements, etc. And the aim is to reverse the blood flow, which is otherwise accumulated into the varicose veins. But this is also not a complete treatment. You need to correct the defaulted anatomical variation caused by varicose condition in the veins. And if it is causing complications like inflammation, the various terminology Watness are used now, that thrombophlebitis, DVT, etc., etc., it has got a wonderful result. Because modern people, allopathy, what you have anti-inflammatory or enzymatic preparations only to be given, and it has got a partial result, or patient is relieved till the medicine is on. But once you do the Rakta Mokshan, be with a Prachan Karma or a Jalokaucharan, you get a result, but no result in varicose veins as such with this procedure.
Okay, sir. Our next question is from Dr. Suvarna Chaudhary. She is asking, what makes the human brain difficult to heal and treat wound? In short, neurological causes of wound healing. She wants to know. Neurological causes of, is there neurological causes in wound healing?
Not able to
Neurological causes.
Yeah.
Hello. Hello.
Hello.
Yes, sir.
Can you repeat the question
Yes,
again?
Sir, we can audio. Yes, sir. Yes, sir.
Sir, she is asking whether there is any neurological causes of wound healing.
Yes, of course.
Wound healing में sir neurological cause
Of course, there are neurological. Yes, of course, there are neurological causes which help in wound healing, and you need to rule out any neurological deficit into the area. The thinking starts right from the deficiency, neurological deficiency to some trace element deficiency. यहाँ से start होता है neurological causes, and you need to exclude. और इसलिए तो जो नॉन हीलिंग वुंड के बारे में सुश्रुत ने कुछ स्पेसिफिक नॉट ओनली द लोकेशन स्थान बताए हैं, बल्कि कॉजेज भी बताए हैं कि नॉन हीलिंग वुंड के क्या क्या कॉजेज हैं. एंड न्यूरोलॉजिकल इट प्लेज ए वेरी इंपॉर्टेंट रोल एंड यू नीड टू इवैल्यूएट फॉर वुंड हीलिंग. सर.
Yeah, definitely there are so many causes. Whenever there is no sensation loss by any cause, either there is myelitis or other tropical or other thing, so there is a definite and neurological causes. If unless until you treat the primary pathology, it is difficult to correct. But as regards the healing process, the leech application I found is very effective in this neurological ulcers also.
Okay, sir. Thank you, sir. Continuing with this wound healing topic, another question is there. In wound healing with Ayurvedic preparations, what is the answer for antiseptic or asepsis of the wound?
Good.
Antiseptic action or aseptic action for the wound?
Yeah. See, advocates Shuddhikaran of the wound is a prime factor for allowing wound to heal. This is very important that you keep the व्रण शुद्ध. और कल वार्ष्णेय सर ने just बोलते बोलते बोल दिया कि wound तो ऐसे ही heal हो जाते हैं यार. You have to create the atmosphere for wound healing. And asepsis is one of the prime procedure you need to follow. And सुश्रुत संहिता के पहले अध्याय में ही एक संस्कृत में वाक्य आता है, व्रण संरोहात यज्ञशील संधानात, जो आगे है उसमें उन्होंने बताया व्रण संरोहात मतलब क्या बोला है, wounds heal. You need not do any extra effort. Only you need to keep the wound clean and sepsis prevented. Then wounds automatically heal. ये हमको नेचर, मदर नेचर या भगवान या सुपर पावर की देन है कि हमारे wound heal हो जाते हैं. Only you need to provide a proper term and condition into that area and prevent the sepsis from occurring. I believe oral administration of antibiotic has got a role, but limited role. The local cleaning of the wound has got a major role, and providing the local atmosphere to keep the wound clean and neat, that is शुद्ध व्रण. शुद्ध व्रण रूह्यमान की अवस्था को प्राप्त हो जाएगा अगर शुद्ध रखोगे तो. एक बार वो दृष्टि को प्राप्त होता है, चाहे दोष की दृष्टि से या स्थानिक दृष्टि की वजह से, the wounds will not heal or wound healing will be delayed. Sir.
गुड डॉक्टर सोलंकी हैज गिवन अ वेरी गुड आंसर एंड कल ही अपने लेक्चर में बताया था आपने लेखन कर्म लेखन
Yes,
कर्म
sir.
is to avoid the microbial load on the wound actually. तो लेखन कर्म प्रक्षालन which you have given already answer yesterday in your lecture. That is, you provide the atmosphere by lekhan karm, you prevent the biofilm by lekhan karm, and other the quat, dhavan, tripla, quat, panchvalkal, quat, etc. They are also help in the asepsis conditions. And regard the antiseptic is very difficult to say in Ayurvedic anything, any antiseptic proved, but asepsis definitely you take the chance to clean the wound actually. That is only helpful in healing of the wound.
Okay. Thank you, sir.
Thank you, sir. So Dr. Varsharani Nipade is asking, please share your experience about frozen shoulder treatment. She's asking to both speakers.
Okay.
Dr. Solanki has given yes.
Yeah, as I said earlier, that a typical treatment for frozen shoulder lies in Ayurveda and it yields result in Panchakarma procedure. Right from Purva Karma of Panchakarma, Snehan, Svedan, etc., it does give a result. But you need to rule out few of the factors, that is causes of frozen shoulder. Frozen shoulder patients are difficult to treat, who are complicated, like those who are having diabetic, those who have got a neurological issues, and muscle wasting or vesting, muscle vesting. Then you get a poor result. So you need to examine the patient. More the chronic condition, difficult to treat such patient. So you need to evaluate, investigate the patient, and then treat. Viddhagni karma right now is very popular in instant result and relieving the patient of the pain, along with exercise, physiotherapy. It has got, you need to maintain the status of mobility to the frozen shoulder. Then you need to treat with very, you can say, multidisciplinary approach towards treating such patients. Varshney sir.
Yes, sir, you have given the answer, correct answer. Unless until you treat the pathology with rogam adau parikhe tadanantaram ausadam. Well, you should examine what is the cause actually. And most of the cases, the diabetes is the main cause. Unless until you correct the diabetes, it is very difficult. And regard the Agnikar, Viddhagnikar, definitely providing good result, encouraging result has been observed by Agnikarma. But you should treat the primary pathology also along with the Agnikar.
Thank you, sir. Sir, there are many more questions. I will take one of them. Dr. Rajesh Wankhede sir is asking, in umbilical hernia, is there any treatment specially for Ayurveda, especially in Ayurveda?
सुश्रुत ने शस्त्र साध्य व्याधि बताए हैं, जिनकी औषधि चिकित्सा बहुत कठिन है या नहीं करनी चाहिए, और इवन चरक ने भी बोला है तत्र धन्वंतरी नाम अधिकार, वो सर्जिकल फ्रेटर्निटी का अधिकार है और शस्त्र साध्य व्याधि है। नाभि जांतवृद्धि का ठीक से वर्णन है और उसका शस्त्र कर्म ही करना चाहिए, ये सुश्रुत संहिता ने भी वर्णन किया है। सर भी बताएंगे।
Varshney sir, are you
correct? You have given the answer. It is anatomical defect actually.
Yes,
anatomical
sir, yes.
defect है, umbilical prolapse हो रही है वहाँ से. लेकिन sometime in children when they grow up actually, what happened? They naturally it heal actually. The defect is closed in early stages, but not in the later stage. If the obesity and other factors are there, chronic staining is there, other and the gap is wide, very wide gap, intestine coming through that gap. Then momentum is coming. You have to reduce and you have to repair it. In children, early stage, it can be just managed by itself, as a child goes.
Yes, sir. Thank you, sir.
Thank you, sir. So next question is Visarpa and Vrana with special reference to cancer. Any treatment protocol is there?
Visarpa and
Vrana.
Vrana.
With special reference to cancer. I think they are considering the wounds which are created in later stage of cancer.
Yeah.
Or Visarpa as a cancer.
Sushruta Samhita in description of the Vran clear cut describes two types of Vran, Nij and Agantuj. And in Nij Vran, according to dosha, they have classified further the Vran, and where the त्रिदोष जिसमें इन्वॉल्व हैं और ऐसे कुछ व्रण कष्ट साध्य से लेके असाध्य की तरफ जाते हैं, इसका सीधा सीधा वर्णन सुश्रुत संहिता में है. It is being described. But you know, while talking to some of the experts of Ayurveda, there are two controversies. Wherever in Samhita it is said that असाध्य व्याधि असाध्य समझकर छोड़ देना चाहिए, ये कहा है. And at second place ये भी कहा है कि असाध्य कहकर छोड़ने की बजाय वैद्य ने प्रयत्नशील रहना चाहिए, प्रयत्न करते रहना चाहिए आखिरी सांस तक, रुग्ण की आखिरी सांस तक प्रयत्नशील करते रहना चाहिए. और जहां असाध्य कहकर छोड़ देना चाहिए ये कहा है, तो छोड़ देना चाहिए ये अर्थ नहीं निकालना चाहिए. ये कहा है कि वहां भेजना चाहिए जहां उसका साध्य करने वाला शल्य विशारद है, मतलब हायर सेंटर को रेफर करना चाहिए. See, we know right now malignancy, be it a malignant ulcer, is not treatable. But there are cancer which medical fraternity has conquered. They have conquered, and these patients survive till longer with the wound itself. So we can treat such patients with the Ayurveda with variety of procedures described in Shasti Upakram. But what result? Are they curable? I have got a question mark. I won't say it is a curable. I won't claim that it is a curable, but we need to attempt, we need to work on that. And in the answer lies in Shashti Upakram. Like, you know, one of the respected Guruji, वार्ष्णेय सर ने नाम सुना होगा, व्यास जी बोलकर हमारे पास पोदार में हमारे टीचर थे, डॉक्टर वासुदेव व्यास सर. वो हमेशा कहा करते थे, answer to cancer treatment is somewhere hidden into Ayurveda and herbal treatment. Somebody needs to dig up and find out the answer. There is an answer to the cancer in Ayurveda itself. हमको काम करना पड़ेगा नहीं.
Okay. Varshney sir?
Yeah. In Ayurveda, they have clearly mentioned the prognosis, sadhya, asadhyata. Dr. Solanki has given also no doubt about it. Thus, there are some sadhya vrana. Karanasya, anupadravya, sukhdeshe. So these are the few sites and the general build of the patient, chronicity of the patient, they help in the healing. Then there are some kracha sadhya vrana. Kushtinam, Misjushtanam, Shoshinam, Madmehinam, Vranel Kachena Siddhanti, Yesham Chapi, Vrane Vrane. These are the difficult, but they can be treated, no doubt about. But there are some asadhya vrana, incurable. They are clearly mentioned. Mansvad Udgata, Goshrangvad. So ऐसे these are the malignant ulcer, and they have classified them into asadhya vrana. But as Dr. Solanki has given an answer, you should not leave प्रत्याक्षेप इनको असाध्य मान के भी you should treat these patients on the, but you can do a palliative treatment, other you can say for that.
Yes. Thank you, sir. Sir, we will take today's last question, sir. Dr. Rekha Mukesh Rathi is asking, please suggest treatment for bed sores. Actually, you have answered in last two questions, but we can answer her.
This is the second or third question from Dr. Rekha, I believe.
Yes, sir. Hence, I thought we should answer her.
Yeah, of course. See, bed sore treatment is a multi-pronged treatment involving multi-specialists. Usually, these are chronically ill patients who are not able to move. So every 1 or 2 hours, you have to change the position. You need to release the pressure into that area, and for that you need a specialized bed. Now, water bed, air bed, such type of soft beddings are available to treat such kind of. Third thing, you have to ensure the very good and healthy blood circulation into that area. Third thing, you have to take care of localized wound, desloughing the wound, and lekhan karma, so Varshney sir ne bhi bataya is tarah se, and very less medication is required whenever you are treating, because these are debilitated patients. Fourth important thing is nutrition and ruling out the deficiency, variety of deficiencies, and you can handle these things. I have a very good and healthy number of patients with photographic evidence, like yesterday I had shown before and after treatment of treating the bed sore. Even in some bed sore patient, Varshney sir, I have done the kshar karma, pratisarni akshar karke प्रक्षालन करके हमने लोकल डिब्राइडमेंट जो किया है क्षार कर्म से, उसका भी बहुत अच्छा काम मेरे हिस्से में आया हुआ है, and we have treated. But remember, you need to have a multi-pronged attack to treat the bed sore patient. Not only one thinking pattern will help in treating the patient. Sir, कुछ बता सकेंगे?
Good, very
Sir,
good.
Vashni, sir.
Again, I told you this has been included Asakdevaran actually in Ayurveda also, but the local hygiene, relief of the pressure, and frequently turning of the position, and local anything. In my study, I did Jatyadi Grat actually. Jatyadi Grat has been found very effective along with the Yasad Vasam orally, and along with the other, if somebody is having paralysis, hemiplegia, paraplegia, etc., they should be treated according to that also. But as regards the wound care, that the local hygiene is very important. You promote the atmosphere about the wound healing. That's very important. And general condition also, you should improve by giving your rasayan therapy, etc., whatsoever you can give. So, but it takes time. It is not a simple thing to say actually.
Okay. Thank you both of you, sir. Sir, now I request Dr. Solanki sir to make the precious announcement.
Yeah, I could see Dr. Shubhangi Badole joining
Yes, sir.
us.
She is also there.
Welcome, Dr. Shubhangi. Shubhangi is another proud student from Podar who has completed UG and PG from our institute. So I welcome her. And there is an announcement, friends. Ayurveda Proctology Association, Bhaskar sir is aware of that. It was formed in Maharashtra in 2017. And it includes all the Ayurveda graduates and postgraduate practitioners who are practicing proctology and in Maharashtra. Initially, it was limited up to the Maharashtra, but now it has spread across and it has taken the form of Pan India. We organized a national workshop cum conference in Malvan in 2017, and I am really happy to say more than 500 participants registered in this workshop, where we completed around 80 proctology operations with live demonstration there with lectures by experts. The second national conference was organized at Ghataprabha in 2019, and there also we have created a world record where maximum number of undergraduate and postgraduate students participated by registering, paying the registration fee. And there also we organized a more than 50 live operative workshop in the morning sessions, and in the afternoon session lectures by experts. Also in these two conferences, we felicitated the stalwarts and father figures in the field of proctology and Ayurveda, and especially in the field of Kshar Sutra. I invite all of you to join Association of Proctology, Ayurveda Proctology Association, and strengthen the संगठन बड़ा महत्वपूर्ण है। किसी भी क्षेत्र में हमने संगठित होना, जैसे कि आपने देखा है नेशनल इंटीग्रेटेड मेडिकल एसोसिएशन बहुत पुरानी एसोसिएशन है हमारी, इंटीग्रेटेड प्रैक्टिशनर की रिप्रेजेंट करने वाली, जिसने आयुर्वेदा प्रैक्टिशनर के राइट्स के लिए फाइट किया है। हमारी आयुर्वेद प्रोक्टोलॉजी एसोसिएशन 15 से 19 दिसंबर के दरमियान एक वीक वेब सीरीज ओनली ऑन कॉन्स्टिपेशन ऑर्गेनाइज कर रही है। From 15th to 19th December, we are organizing a web series, lecture series by expert speakers from Ayurveda as well as allopathy, right from the causes to the diagnosis to the treatment and surgical intervention of constipation. So please join us. I think details will be with Dr. Shilpa ma'am and Dr. Vinaya. मैं उनके पास भेज दूंगा जल्दी इसके लिए, और आयुर्वेद प्रोक्टोलॉजी एसोसिएशन का मेंबरशिप फॉर्म भी इन दो लोगों के साथ में भेजूंगा। Thank you very much.
Thank you, sir. Thank you, sir. Now I request Vinaya ma'am to introduce Dr. Shubhangi Badole ma'am.
Good morning, ma'am.
Hello.
Dr. Shubhangi Badole ma'am. She is currently working as a associate professor in the department of Shalya Tantra in YMT Ayurved College, Kharghar, Navi Mumbai. Ma'am has done research work in Kshar Sutra and currently doing her PhD research on Agni Karma. Ma'am has special interest in managing spine conditions with integrated protocol. She has conducted hands-on training workshops on Agni Karma and Rakta Mokshana. Ma'am has treated more than 5,000 cases successfully with Agni Karma and Rakta Mokshana. She is strong follower of Sushruta Samhita and try to promote its proven teaching with evidences. Now I request ma'am to enlighten our brains with her knowledgeable guidance.
Welcome, ma'am.
Welcome, ma'am.
Thank you. Good morning, all. Good morning, Solanki sir. Good morning, Vasai sir. Sorry, मुझे थोड़ा late join होना पड़ा. I was there, but I was traveling.
Yes.
कल का session भी काफी अच्छा रहा. So before starting the session, many thanks to the organizing committee, Shalya department, SMBT Arabic Medical College, Igatpuri, Dr. Shilpa, Dr. Vinay, and the team, and principal sir, Dr. Pradeep Bapat sir, for inviting me for this beautiful webinar on parasurgical procedures. Yesterday, I attended the same and enjoyed the session of Dr. Kadri sir, Dr. Vasne sir, Dr. Solanki sir, and Dr. Samudri sir. Sir Vasne sir, good morning. आपका कल का सेशन बहुत अच्छा रहा. I enjoyed the steps you developed during the research you done on that parasurgical procedures. I heard about your students. You are mentioning your names of your students. That was also very good. And I can see that how you will you are feeling great or proud about your students also. And thank you, sir, for sharing your experiences about the research, and that will give the boost for the future generation, and keep the data of the patient, and do the research in our pathy. And Dr. Solanki sir has done great job as always. He's a very good speaker and very much good commenter, coordinator, and a very one of my great gurus. And his session was very informative, and he has given up all his clinical experiences and about the hidden treatment in Shashti Upakramas. The session of Dr. Samudri was also great. He's the boss of one of the boss of Sharakarma. So today's morning question answer session was also nice. Dr. Vinay and Dr. Shilpa, you did a good job, and the questions are also good. Thing is that now all the pathies are looking at Ayurveda science, and being this Shalya Tantra department, as per yesterday's 2 days before we got the letter circulation regarding the surgical procedures, and we are doing this webinar on some parasurgical procedures. So world is looking at us, they are expecting something from us, and government is also expecting from us, and we should give some promising results with our work. So I will want to add that research means keeping the data, sharing the experiences, what we are doing with proper protocol, and sharing the proper authentic publications is very much important. So it will give the weightage to our point. No doubt, Sushruta Samhita or other Samhitas have mentioned properly about the about the all the treatment part and pathophysiological part. But the world want the research data, so we should add to that. And with this, I will start the session regarding the Agni Karma with the permission of Dr. Vasne sir, Dr. Solanki sir, and the team of SMT College. So, can I share my screen?
Yes, ma'am.
Yes, sir.
Vinay madam, can I share my screen?
Yes,
Yes. Sure.
Okay, thanks. Yesterday, cupping therapy, Kshara Karma, and about Rakta was discussed. And today's topic of session, this session is scope of Agni Karma in current practice and its review from the Sushruta Samhita. I always mention the name of Sushruta in all my slides and all my presentations because he noted down all the knowledge about the surgical procedures, and we can practice with all the permissions with that manuscripts we are having of the Sushruta. So we should be very much thankful to Acharya Sushruta. Today in this today's session, I'm always happy. Hello, I'm audible.
Yes, ma'am, you are audible.
Okay. This session, I will try to have the what I am having the experience about the Agni Karma and some Rakta Mokshan procedures, because we cannot divide Agni Karma and Rakta Mokshan in two boxes because both are pain management procedures, and I will try to simplify the way how we should do the Rakta Mokshan or Agni Karma, what we should choose while doing the pain management procedures. Agni Karma is indicated for pain management and again the disease management. So I will throw some light on that. Plus, I will share some videos of the patients pre and post about the procedures of Agni Karma. So currently, I'm working at the Dr. G.D. Foundation, IMT Ayurvedic Medical College. And we do have a research center and postgraduate study center also. And here we are doing a great, as I can say proudly that we are doing some research work in Agni Karma, Rakta Mokshan, and other parasurgical procedures, and about the Shashti Upakramas and other conservative treatment written by the Sushruta Samhita. With the great blessing of Acharya Sushruta and Bhagwan Dhanvantari, we'll proceed to the session. So this session, actually Agni Karma is for pain management and disease management. But in one session, we cannot cover all the points. So this session, I will try to be more about the pain management procedures. So pain definition of pain varies in day by day. So every time the new definition come about the pain, because it is a vague symptom and it is associated with so many diseases. So where in Agni Karma, if we are talking about Agni Karma, we generally use pain management for musculoskeletal disease with the Agni Karma procedures. In Ayurvedic science, it can be said as Shula, Vedana, Betha, Puja, Shul, and it can be Sharir, Manasik, Nija, Agantuj, and even Shukari and Chirakari. And even it can be Prakrut like Prasav Vedana and Vikrut like Udarashu. So it is mentioned in Sushrut Uttarasthan, 42nd chapter. So this scale I have kept because we cannot measure the pain in quantitative way. As academician, all the academicians and research institutes follow this protocol that we should mention that on the paper also the grades of the pain, and if some practitioners are attending this session, I want to give them the message that they should keep a chart like this in their OPD next to their chair or somewhere, the broad, bigger one, so that patient can indicate the pain symptom of the gradation of pain or intensity of pain they are suffering. So the phases, either it will be a visual scale or NRS scale, both you can keep. And we are practicing this in our OPD, and the patient always get happy that next time, even we can say that next time I expect this phase from you. So once the patient patient come in your OPD and he says, no, I am improving. Now I am at this stage, I think. Okay. Or you can use that NRS scale also, where numbers can be mentioned. So, principal management of pain, it is general management or local management. But local management is always preferred for the pain management of musculoskeletal diseases, where Rakta Mokshan, Agni Karma, Viddha Karma, and external Panchakarma is done. So today's topic is related to, very much related to Agni Karma. So other other pharmacological pain managements are like some physiotherapy techniques, that is tense acupuncture, nerve block. Some surgeries also there, and other aromatherapy and other are there. And same way, all pathies or all the paramedical pathies are also working on the pain management. So they have their own modalities. It works same in our Ayurveda. There are some local therapies for pain management, that is Snehan, Svedan, Upanaham, Mardan, Alep, Bandhan, Rakta Mokshan, and Agnitam. Okay, so all these local therapies have its own indications, procedures, and still limitations. So one local management is not the answer for all the own indication. Agni Karma procedure. When we are using any heat, or thermal heat, or any type of heat energy for the treatment part, it is called as Agni Karma. That is Agninam Krutam Karma Agni Karma. So in Shushruta's era, the heat energy was the only energy as which can be said as a thermal energy. At that time, the laser therapy or electro. So that time, the thermal therapy was only being used. But in today's world, the technology is developed, and so anything that, because energy cannot be generated, it is only being transferred or in other form. So we can say that laser therapy, electrical current therapy can be said as Agni Karma, as per my thought. Controversies are there. So, major part, one is pain management, and second is disease management. We again almost let's talk about that is still hidden, because we are using Agni Karma for disease management in many procedures, like even the wards, electrocordons, cons. So we are using the electrocord, but we have Agni Karma. Okay. Generally, for Agni Karma is for pain, and it's not like that. It is for disease management also. And even in Samhita, the Shushu Samhita Sutrastan, chapter number 12, the whole of the chapter is dedicated for Agni Karma. I like to mention that in Shushu Samhita Sutrastan, continuous consecutive 3 chapters are being mentioned for Kshar, Agni, and Jalakaucha. That is 11th, 12th, and 13th chapter. And in 12th chapter, Agni Karma is mentioned, that Agni Karma Vidhi, how to do the procedure of Agni Karma, what are the instruments of Agni Karma, what are the basic indications of Agni Karma. So, in that, it is clearly mentioned that Agni Karma is firstly for the pain management at Karma Ausas, Siras, Nani, ST Services, and for disease management, it is used for Nadipuran, Bagandar, and excision of other wards and other. So these are the pain management diseases where agriculture is. And next list is related to the diseases where Agni Karma can be used as the excision procedure or for simple excision by burning the cauterization of that tissue. So for pain management, we can use Agni Karma from head when to use the basically when to use that Agni Karma or Rakta Moksha is again the doubt. So simply this doubt is being cleared by our Shishur Samhita in the chapter Vatvadi Chikitsa. And there he has instruction to be applied used, and these are conditions where agriculture should be used. So what we require for the procedure of Agni Karma, that every clinician should have this set, at least this set for the Agni Karma procedure in his setup. So a tray containing drips, sterile drips, Agni Karma shalakas, holder. If the shalaka is smaller than like Suvarna shalaka, we need the holder like any artery forceps. Then every procedure what we require for the cleaning of the part and post procedure any sticker dravya we need, and if you are doing any research work we need the calipers for the measurement of the pre and post improvement. Talking about the Agni Karma Shalaka, which Shalaka should be used? Clearly mentioned that in site of disease is situated and that case, in Tokakat cases, that is if the disease is related to cancer, the Pipali, Ajashakrut, Godanta and Sharashalaka is mentioned. And I'm very happy that we work on the Pipali also and some Sharashalaka also. Ajashakrut we are going to try. We have collected that also. In Mausagatana, Suvarna, Tamra and Panchadhatu Shalaka is used. And even here we want to do a deep-seated Agni Karma. The Sneha Dravyas are used. Mritika Shalaka, which is developed by Dr. Gupta sir, we are using. So this is the Agni Karma set we do have at our institute, and there are some Tamra Shalaka, Rajat Shalaka, Suvarna Shalaka, even when German Shalaka is also there. We are also using herbal products like Pippali, Agashakuru, Haritra, Bhalattak, and Mritika Shalaka. Aloe vera gel, raw aloe vera pulp generally we use, and we do have in our campus only. So now we will talk about the heat sources which should be used for the Agni Karma procedure. It is a little difficult to use spirit lamp as it is our in the teaching institute and interns and KV students used to do the Agni Karma, and in that cases it can this, spirit lamp can get blast anytime, so we are not using that blast. So candle we are using, but the drawback of the candle is it gives that black surface on the shalaka. So, but still candle is preferable that it is cheaper. And the second we also build some instruments. Yeah, maybe are using the low shalaka, amra shalaka. Okay, very high. So in that case, we need gas. Like gas. Sorry. Production method is developed by Dr. Gupta. Heat is being.
Madam, you have some network issues. Network issues. Your voice is not coming clear.
Hello.
You have some network issues. Your voice is not coming clear.
Now I am audible.
Yeah. Now you are audible.
Hello.
Madam. You are audible now.
Okay. Okay, thank you. Here the shalaka is kept on the affected part, and it has been heated at one end, and the heat is transferred to the affected part. This conduction method is developed by Dr. Guptesam. What I want to mention is that this is very safe for Agni Karma, because we are not expecting that Tokadagda Lakshan or Mansadagda Lakshan. Here only we are transferring the heat. So what happens that this is very much under control of us also, and even patient can tell us that, oh, it is getting heated now. So just remove the shalaka. So we can remove the shalaka. So 10 cases this and with this conduction method, and result was also good. And in direct one, we have to heat the shalaka, and once it get heated, we keep it on the affected part or where the agnikam has to be done. But here we are expecting the Topadagda Lakshan. These are the types of Agni Karma. So Agni Karma is according to its shape, the site, material used, stage of intervention, and surgical procedure is divided. But it is all theoretical part, and we cannot cover in one session. So this is what I want to give the message to the viewers, that when Agni Karma should be used and when Rakta Mokshan should be used. So it's very clearly mentioned in our Sahitas, in Vatvedi Nidan Adhyay, which is the first chapter of Nidan Sthan. And here almost all the painful conditions, general diseases like Pakshaghat, Vatrakta, Apatantra, Apatana, also mentioned in this chapter. And here in the Nidan Sthan, the pathophysiology of Vatvedi has been mentioned. And in Chikitsa Sthan, there are two chapters for Vatvedi and Mahavatvedi. In Mahavatvedi, Pakshaghat, Apatantra, and other diseases, general management is mentioned. And in Vatvedi Chikitsa Adhyay, Sushruta has mentioned about the treatment of this diseases, painful diseases, and treatment according to the involved sites of that diseases. In Nidan Sthan, the mention that what the symptoms are mentioned about the painful condition, we should go through, because we should know the diagnosis of the disease, diagnosis of that painful condition. Because once we know that this disease is related to this tissue, then only we can do the procedure. So here you can see that in Sushruta Chikitsa Sthan, he has explained Rakta Mokshan for Tvaka, Mamsa, Asruk, and Siragat diseases. So what are the Tvaka, Mamsa, Asruk, Siragat diseases? That we should know first, and then we can go for the Rakta Mokshan. And even in for Agni Karma, he has mentioned Snayu, Sandhi, Astit diseases. So we should know that what are the symptoms of the diseases, so we can come to the diagnosis part, and we can then go forward for that treatment part. So in Nidan Sthan Adhyay, Vatvedi Adhyay, slok number 25 to 29, he has mentioned about the Tvakagat, Raktagat, Mamsagat, Medagat, Siragat, Snayagat, Sandhigat, Astigat, Majjagat, Shukurgat. Means almost all the Dhatugat, Vath symptoms. So I have done a little simplified it. Majjagat and Shukragat has not been included for Rakshan and Agni Karma, but others have been included. So I just simplified that symptoms. For Tokagat, the symptoms are Vaivarnya, Spuran, Roksha, Sukti, Chimchiman, Todan, Tokabheda, Pariputan. So all these symptoms are somehow about the neurological symptoms or neurological conditions. So dermatome theory can be implemented for this, because Chimchima means tingling, supti means numbness, and all these symptoms are related generally with some neuropathic conditions, and some are with lymphatic symptoms because it diseases also, and some are with some vascular changes also. In Raktagat, it is mentioned as Vran. When the Vran is formed, that is ulcers are formed, it is called as Raktagat. In Mausagat, we can say it is, we can observe it as a Mausagat. What means? It is muscular spasm, that is Sarshula Granthi, that is spasmodic muscle, which is painful one. In Snayagot, it is Stamba, Kampa, Shula, and Akshep. So all the snayus, that is ligamental diseases, can be included in this. Sandhigat, that is Sandhinash, Sandhishul, and Sandhishop are the selectioners, which are being all the arthritis condition. And here I mentioned about that vertebral notch or vertebral joint disease. And in Astigat, Astishoka, Shula, and Veda. So Astishosha, Shula, and Veda is mentioned as Astigat. So these we can, firstly we have to correlate a little about the modern part, and we have to investigate the disease, and we can go for the treatment part. So for treatment, what Sushruta has mentioned in Vakyari Chikitsa Adhyay, that is Tvaka Mamsa Rakta Sira Gatvat. The disease is related to Tvacha, Mamsa, Rakta, and Sira. We should do Snehan, Abhyanga, Upanaha, Mardan, Alepan along with Rakta Moksha. Okay, so we can do Snehan, Agni Karma, Rakta Mokshan, but only Rakta Mokshan is not the answer. We should do Snehan, Abhyanga, Upanaha, Mardan, Lepan. Again, it depends on the symptoms or disease dosha also. So Rakta Mokshan, we can choose Vegdhan, we can do Sira Ved, we can do Prachan, Jalakaucharan, depend on the other doshas also. And when the disease is little deep seated, that is Snayu, Sandhi, and Astigat, we should do Agni Karma along with Snehan, Upanaha, Bandhana, and Mardan. So in that case, we can choose the Shalaka according to the disease also. So for disease management, generally we do for when we want to do the disease management, that is eradication or excision of any con or excision of any wart, we have to heat the Shalaka on the higher side. So here we want to do only that pain management. In that case, we don't need any hot burn and Shalaka. Here we just want to give Tvakadagda. Once we give the Tvakadagda, heat will transfer to the lower structures, deeper structure. So how many sittings should be there? How many times we should do the Agni Karma? The answer is also given beautifully in our Samhita at the last line only, that is Atandrita. Puryat Atandrita means till patient gets relief from the symptoms or till he get totally satisfied, we should do the Agni Karma. Again, this, how many sittings, how many times we should call the patient? Every month, every 15 days, every 8th day, every 5th day. It is always a research protocol. It is not mentioned in our Samhita that first we should call a patient for Agni Karma on 3rd day, on 4th day, on 5th day. In Shtar Sutra, it is mentioned on every 7th day we should change, but in Agni Karma, as and when required, we should do. Basically, if you are doing the Tokadagda, the 7th day we can repeat the Agni Karma. So Agni Karma and Rakta Mokshan, when we should use that as combination therapy, when the disease we see that it is Mamsagat also and it is Astigat also, in that case we have to do Rakta Mokshan followed by Agni Karma. Dr. Vinaya, hello.
Yes, ma'am.
Hello.
Hello, ma'am.
So,
Yes.
Yes,
Yeah,
ma'am.
I'm audible.
Yes, sure. You are audible.
Okay. Now I want to share some videos of my patients, what we have done the procedures of Agni Karma. Some of are conductive type of Agni Karma and some are of direct type of Agni Karma. Before starting that, I will like to give my tribute to Dr. R.V. Gupte sir, from whom I learn all the Agni Karma procedures, and Dr. Mahesh V. Sanghvi sir, who is a great guru of mine, and he's also doing good work for parasurgical procedures. He is master of Shastra, master of rectal surgery, but he is doing Agni Karma also, and he always give inspiration to me for doing more research work. And he is the one who give me the all the opportunities, whatever he will get to do Agni Karma. And so, what things we should keep in mind before doing any Agni Karma procedure? So, we should have the thorough knowledge of anatomy, all the musculoskeletal system, what are the marmas situated near to the site, and dermatomes. So, while doing this Vedam Chikitsa, even I mean Agni Karma, this dermatome therapy theory is always been very much useful. So, we should know that. How much sittings are required, any other treatment is required with that procedure, we should be clear. Pre-Agni Karma assessment, generally we should see the bell of the patient. Then any other disorder or any, we should, if even if you are doing the Agni Karma, you should do all the protocol. We should see that temperature of the patient. We should see that blood sugar or level of the patient, blood pressure of the patient, general condition of the patient, and Rutukar is mentioned here. But if in heated season we can do the Agni Karma under the air conditioner room also. Should we keep the patient NBM for Agni Karma? Not needed for pain management therapy. But when we are doing for some major surgeries where Agni Karma is used and anesthesia is being given, we need to keep the patient NBM. Procedure of Agni Karma is different for different diseases and different shalaka, but cleaning up the area, dripping of the place, consent, taking consent of the patient, then proper heat source, and getting the procedure and getting the exact lakshana of Agni Karma, that is Pakadakta, Mansadakta, we should follow. And post procedure, we should apply some Sneha Dravya when we are doing the Vruksha type of Agni Karma. So first we will see the Agni Karma procedures for the spine condition. So these are the diseases of spine, that is some are muscular problems, osteoarthritis, spondylitis, spondylolisthesis, degenerative disc, herniated disc, and stenosis. In muscular spasm and in paraspinal muscular spasm due to strain or lack of physical activity, we get this pathology where Vedhan and Agni Karma as a combination therapy works very nicely. And here I have shown that we are doing Vedhan of the patient with 26 number needle followed by Agni Karma of conduction method. In osteoarthritis of the spine, where compression is on the nerves fibers is there, which is causing the radiculopathy, we can do Agni Karma with Tamra or Suvarna or Rajashalaka. Here we should try that Agni Karma or Agni should be reached at that articular joint. So here we are showing. I'm sure I also show the videos also, but here just the photographs here I'm sharing with you. Here we are doing with Agni Karma with conduction method. You can see that Shalaka is being held in the wooden frame. We are using the candle and the heat is transferred from one end to the other end. In degenerated disc, again we can do Agni Karma with Tamra Shalaka, as disc can be said as the Snayu. In herniated disc, we can do Agni Karma. In spondylolisthesis, where slippage of vertebra over one vertebra below, where compression of the spinal column is there. And here we should be very careful because this disease is generally a surgical disease where surgical correction is required to fix that vertebra. And so Agni Karma and Raktamoksha and other therapies have some doubts about the treatment, where if you want to do the treatment in grade 1 or grade 2, you can do the treatment with Lepe Chikitsa Bandhan and all that, and for pain management you can do some Agni Karma, but Joloka works very nicely in that listhesis cases. But again, I want to mention in grade 3 and grade 4, the surgical correction is required. In spinal stenosis, again, it is doubtful, where surgically we have to correct the cause. In plantar fasciitis, morning only I heard the questions regarding Parshnishul. So plantar fasciitis is a type of Parshnishul. Here the degenerative inflammation is there on the plantar fascia, and 1 in 10 people generally suffer from it. So here it is again a Snaigatvat, so we can do Agni Karma. And here I am sharing one case of mine. The patient is of 64-year male who has been diabetic from 25 years, and he was having soul pain from 8 to 9 months. In this case, we have done X-ray and other blood investigation. X-ray was normal, CBC and uric acid was also normal. Generally, in pain of the lower leg, I preferably do uric acid also. So we have graded its pain in grade 3, stiffness grade 2 and tenderness grade 3 in the first sitting. And ultrasonography of the plantar region was done, and the fascia was of the left affected foot left was there, and its fascia thickness was 6.8 mm. So we did Agni Karma with Mritika Shalaka, where 6 sittings were given. That is one sitting into twice a sitting a week. So Mritika Shalaka, aloe vera and heat sour we are using is the handle. Here we have marked the painful point and did the Agni Karma with the Mritika Shalaka. And you can see that after 3 months, the left foot plantar fascia thickness was same as right one. So this type of treatment can be given by Mritika Shalaka. In calcaneal spur also, if it is painful, generally calcaneal spur is not the patient. The spur beneath it is generally don't give the pain. The fasciitis, that is inflammation of plantar fascia, gives the pain. In neosteoarthritis, we can use Agni Karma with Suvarna Shalaka with conduction method. Frozen shoulder, I will show you. And other painful conditions, that is carpal tunnel syndrome, tennis elbow, and trigger finger, we can use Agni Karma and Raktamokshan both. I would like to share some videos with you. Dr. Vinia, I am audible?
Yes, audible, ma'am.
Hello.
Hello, yeah, ma'am. Audible here. Ma'am, we can hear you.
Hello.
Yes, yes.
Hello, Padala ma'am. You are not audible now.
Okay, I will share some videos.
Now you are audible.
Okay, okay, thank you. Yeah, okay. Points that are painful points on the lower back side. Again on the leg, we are marking the points for Vedan Karma. That is 4 angle above and below the knee joint on the Parshni Pradesh. That is is turned down near the Chipramarma. Here Vedan with 26 number needle. During Vedan, because we are doing Vedan means some capillary blood is coming out at that site.
Ma'am, Badula ma'am, we don't have your voice. Huh? Disconnect. नहीं ना सोलंकी जी गाड़ी Solanki sir, I think Badole ma'am,
There is some technical problem.
she is disconnected. I think
Technical problem for
Maybe internet connection or something.
Al.
Just wait. Give her time.
Yes.
और विनय रिंग करून बघ त्यांना.
Yes sir.
Okay.
Yes sir. She has called me there.
Hello. Hello. Hello.
Yes ma'am.
Yeah, Shubhangi, you are audible. Please share your screen.
Badole ma'am, you are audible. Please share your screen.
Hello.
Hello, हाँ ma'am.
Hello.
हाँ ma'am. Share your screen please.
Sir, I think a technical problem झाली ना माझ्या side मला वाटतं. Okay, I will share my screen again. Okay, thank you. This was the video I was showing you. Here we are doing Vedankar.
Video is not seen, ma'am. Again not. Again disconnected. Solanki sir. Hello, ma'am. Is there muted? Sir, yes, ma'am. Ma'am, you are visible. You are visible.
Yeah, thank you. I will share the screen again. Sorry, what is happening? This is the case of frozen shoulder. So before Agni Karma, the movements are restricted. We are marking the painful points related to shoulder joint, anterior part, and posterior point. Here we are using wood, that is jaggery for Agni Karma. We have made some jaggery shalata. Mold with the mold. Only in cases of Dept, we should be much careful while doing it also. Give the burn on the Agni Karma point. But again, it is a skill. If you do it with proper way, no boil is formed on the site. After Agni Karma, the restriction is improved. So generally, According to are being done, you have to do the Agni Karma. Along with, if you add Nasya with this treatment, it will give the dramatical result. For partially we'll do Agni Karma. Here we are marking the painful points of the patient. Skin marker in the market, we can use the skin marker because here we are hitting that Mritika Shalaka. The beauty of Mritika Shalaka is that when we are hitting the Shalaka, the heat is generally not transferred till our fingers. We can hold that Shalaka in the hand also. And once we put that Shalaka on the patient's body surface, the heat will transfer to that body surface. So we are putting that Shalaka in. We should do the Agni Karma with Mritika Shalaka till patient says, "Oh, it's too hot to move that Shalaka." Again, this thing. So again, the sitting should in Mritika Shalaka we can give 2 sitting in a week also. This is a case of sciatica where pre-procedure SLR was almost 20 to 30. We have marked the point. We have done the Vedan Karma on back side and on the leg also. So these are the points what mentioned in our Samhita, that is Sira Ved Vidya Adhyay of Sharirsthan. After doing the Vedan Karma, we did Agni Karma with Rajas Shalaka of direct method. That is, we are heating that Rajas Shalaka on the candle and applying it on the painful points which are marked before. And we are applying aloe vera pulp immediately after Agni Karma so that burn marks will not be developed. So once patient come in OPD on the very first day, if you do this Vedan with Agni Karma and his SLR improved on the very first day, patient will naturally accept your all other treatments also. So you can see that SLR is improved with very one sitting of that Agni Karma. I just conduction method. We'll see if this video is being open. It's unable to open this. Is it visible?
Yeah, yes. It is visible.
Here I am want to show the conduction method of Agni Karma, which is developed by Dr. Gupte sir. Here we are using that Suvarna Shalaka. We have marked the painful points, and we are here for conduction method, so we should be very careful with the of the patient. So we should wrap the patient properly while doing this Agni Karma, and we should use gloves also as per protocol, and even for so we should heat the shalaka till patient feel the heat of that shalaka. Yeah, once he said okay, bas with his hand, we should stop that. So we are doing again. This is the Swarna Shalaka of Dr. Gupte sir. Immediately, should not wait. After first heating of Shalaka, in second point, the Shalaka is having its own temperature of previous heating. So here the heating is required little less. So Agni Karma is a technique which need training for this. Once we get a proper training and proper assessment, we can do. So here Agni Dakta Lakshan is also been reduced. Same is the case for cervical spine. We are doing that conduction method Agni Karma. Here the painful points are marked. And while doing on the cervical region, we should wrap the patients here because we are using candle or any heat source if you are using. We should wrap the patients here so that that wax will not fall on that body surface. Should spinal space, intervertebral space, and laterally the passage joint. अग्नि कर्म से डरना नहीं है, अग्नि कर्म करना है, बट अग्नि कर्म करना है तो अग्नि कर्म का टेक्निक सीखना बहुत जरूरी है. मेरी प्रैक्टिस के शुरू के दिन में आई वाज वेरी मच अफ्रेड विद अग्नि कर्म. ये क्या है, ये पेशेंट जलाएगा, पेशेंट को कुछ जख्म होगा या कुछ है. बट इफ यू have the proper training or know the proper technique, so here we can see that every time we don't have to hit the shalaka that much. This is trapezius muscle we are targeting. So with this, neck movements will also get improved and pain will also get relieved. So same way we can do on that spine also with the conduction method. This conduction technique is very much safe, although it is not giving Prakadagda Lakshan or Mausadagda Lakshan, but the purpose is solved and the cases are being cured properly. But for conduction, we generally need Swarna Shalaka. Shalaka is also good, but in Panchadhatu Shalaka, we cannot do. Basically, our control. Because if you are doing Agni Karma with red hot Panchadhatu Shalaka and all that, the burn marks will remain for at least 6 months, and that burn wound will remain up to 2 months also. I have observed the patients with the Panchadhatu Shalaka also. That burn, sometimes the burn marks will be there for 15-16 days also. So we expect that patient should come again for the treatment, and we expect that patient should bring other patients also. So we move for the presentation, what we were there. So after this, we are sharing videos. I just want to add little things about Agni Karma. So why Agni Karma is preferred? Because it is minimal invasive procedure. It is OPD procedure. Effect almost in 3-4 settings. Drugless therapy and patient's routine is not affected. Cost effective for patient and even for the clinician, and is Indian therapy. The theory about how it works and all that is almost theoretical one. That it improves local circulation, stimulate regional nerves, increase tissue metabolism, decreased infection and other things, increase muscle relaxation. So take home message with this today's session, I think I should give that don't keep here about the Agni Karma. Get trained as earliest. Try to use the Agni Karma procedures. Keep the data. And prior doing Agni Karma, first investigate the cause, diagnose the disease origin, that is site of the disease, and be careful about the conditions where Agni Karma can be act as absolute treatment. Like in plantar fasciitis, we can do Agni Karma. We can treat the plantar fasciitis with Agni Karma only. We don't need any other consecutive treatment. The condition where supportive treatment is required with Agni Karma, like in prolapse intervertebral disc or radiculopathy, we need some Katibasti and Yog Bastikram with some other oral medicines also with Agni Karma. You should know the limitations of Agni Karma. Pressure of Ishalaka is and number of settings required, we should be know. Combination therapy of Vedana and although it is a Ardha Chikitsa, but weightage of this is always remarkable. And if you add Agni Karma in your treatment protocol, the results will be miraculous one. I used to refer Vidyan Agni Karma Chikitsa by Dr. R.B. Gupta sir, and he has wrote this book very nicely. almost, I think sir must be having the almost cases more than 1 lakh treated with Agnikarma and Vedhan both. And in this book, he has mentioned it very nicely about Agnikarma and Vedhan Chikitsa. So if someone wants guidance about this, they should purchase this book. So with this, I will end my session, giving thanks to Dr. R.B. Gupte sir, Dr. Mahesh V. Sanghi, Dr. Sanjeev Yadav, who is Dean of our institute, and my PhD guide, Dr. Vidya Dharne, who is my colleague and a mentor of mine, and my department, my Shalya Tantra department, and Dr. G.D. Foundation, where I work, and who give me this opportunity for my work on Agrikarma and always support for this. And today's webinar organizers, thanks all, thanks the viewer. Dr. Vinia, thank you.
Thank you, ma'am. Thank you, ma'am, for encouraging for Agnikarma procedures. Your presentation is shown full aspects of Agnikarma. Also, you have shown all the procedures. So, thank you very much. I would like to ask Dr. Solanki sir, would you add something, sir?
I think Shubhangi's presentation was very wonderful, and she had shown even the video presentation on some of the conditions.
Yes.
And she has kept no room for any addition or any suggestions for that. I congratulate her for presenting the wholesomely the Agni Karma and covering the even minutest detail. And she was absolutely free to admit that at initial condition what fear she had and how she overcame it. She has shown the instruments also, the way the heat conduction is classed, and different shalaka, even the Mritika shalaka, etc. So, very good presentation, Shubhangi. You have left very little scope for me to add anything.
Thank you, sir. Thank you. Thank you, sir.
Varshney sir is there?
Varshney sir?
Yes, I am here.
Yes, sir.
ये तो गागर में सागर एक कहावत है.
Oh, sir, thank you.
गागर में सागर नहीं, समुद्र को एक जो है गड़े में बंद करना. इतनी नॉलेज को आप जो है बहुत थोड़े समय में कैसे कर पाए, आई डोंट मतलब डाउट, लेकिन बहुत अच्छी तरह आपने किया. 3 नाम लिए आपने और तीनों मेरे साथ जुड़े हुए थे, यादव और गोगटे सर एंड संघवी. गोगटे सर तो मेरे बहुत साथ में बहुत साल रहे हैं, मैंने उनको नजदीक से देखा है. इज ए फेमस सर्जन. और जैसे मैंने बोला, पूना जो है एक दूसरी काशी है. महाराष्ट्र की काशी जो है वो पूना ही है. वहां से बहुत से विद्वान जो है हुए हैं. तो शल्य क्षेत्र में गोगटे साहब का नाम तो कोई छुपा नहीं है. इज ए वेरी गुड सर्जन आल्सो. और ये पैरा सर्जिकल मेजर जो उन्होंने डिवाइस किए हैं साइंटिफिक वे में किए हैं, और आपने साइंटिफिकली उनको दिखाया है, बहुत अच्छा लगा. और आपने सबसे बड़ी बात ये कही कि भैया ऐसा नहीं है देख के शुरू कर दो, यू मस्ट हैव ए प्रैक्टिस, यू मस्ट हैव ए नॉलेज, एनाटॉमी एटसेट्रा. सो आई थिंक योर डेमोन्स्ट्रेशन वाज वेरी नाइस, वेरी नाइस. इट रिक्वायर्स इन पीसेज एक्चुअली. ये समुद्र हो गया, बहुत बड़ा समुद्र है. बहुत अच्छा प्रेजेंटेशन था. थैंक यू वेरी मच. थैंक यू.
Thank you, Varshney sir.
Thank you, Badale ma'am.
Thank you, ma'am. Now we are happy to declare the winners of paper today,
Which was our supposed to be done second day.
Okay. There are 52 abstracts reached to us. Out of them, we have selected 36 abstracts for the scientific proceedings. And out of these 36 abstracts, our experts choose 5 papers divided in 3 numbers. So for the third position, we have given two students. First student is Dr. Rutuja Chauhan. She is PG scholar in Shalya Tantra department from Nigdi, Pune, College of Ayurveda and Research Center, Pune. And second is for third position, second student is Dr. Tejasvi Sadashiv Patil. She is second year PG student, Strirog Prasuti department, SMBT Ayurveda College. Her topic is parasurgical procedures in Ayurveda related to Strirog and Prasuti Tantra. So she is from other faculty. And our second prize goes again for two students. First is Dr. Mohammad Akbar Iqbal Qureshi. He is from Nagpur Government Ayurved College. His topic is importance of parasurgical procedures in Ayurveda. And second student is Dr. Vinod Karale. He is also final year PG student, Shalya department. His topic is the importance of Agni Karma in current Ayurvedic surgical practice. And first prize goes to Dr. Satyanarayan. He is first year PG student, Shalya department, Parul Institute of Ayurveda. I think he's Gujarat. He's from Gujarat. So this is these are our 5 winners of the session. And now I hand over the Thanksgiving topic to session to Dr. Shilpa ma'am.
Okay. Thank you all actually, and all honorable members and participants, our most valued invited guests, ladies and gentlemen. It's my privilege to have been asked to propose the vote of thanks on this occasion. I, on the behalf of my own SMBT Educational Trust, SMBT Ayurved College, and Department of Shalya Tantra, and on my own behalf, extend a very hearty vote of thanks to all speakers for gracing your important work and sharing with us for your findings and opinions in our conference. A big thank you to Dr. Varshniya sir, Dr. Solanki sir, Dr. Kadri sir, Dr. Samudri sir, and Dr. Badule ma'am. I mentioned in this conference at least 2-3 times that this conference changed the mind of mine, and due to my mind, it will change the mind of my department. Okay. I would like to take the opportunity to place the record of hearty thanks to our SMBT Educational Trust for the perfect logistics support and guidance and availing opportunity for us. Then I also extend my thanks to our respected principal, Dr. Pradeep Bhavat sir, for his enormous cooperation and motivation in the organization of this event. I am also very grateful to Dr. Yogesh Ushi sir, Principal D Pharmacy College, for giving us full positive support and help in publishing our scientific proceedings in his ISSN certified journal. Well, ladies and gentlemen, an event like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird's eye for details. We have been fortunate enough to back up a team of very motivated and dedicated colleagues of our organization who know their job and they are result oriented. I will like to mention some of their names here. With lots of thanks, Mr. Suresh Nagre, Mr. Vaibhav Lohar, Mr. Faisal from our media department, then Mr. Satish Umbarkar for his great help in setting scientific proceedings. I cannot thank everyone enough for their involvement and their willingness to take on the completion of the task beyond their comfort zones. Very on this board, I must thank all of them. And with all, I must thank to my beautiful department, Dr. Vinaya and Dr. Smita, for dreaming of and for completing the task that our institute given us. So once again, thank you very much. Our publication will be released around 3 o'clock with IPGO2 site. I will mention the site in my WhatsApp group for the paper. Okay, thank you,
Thank you, sir. Thank you,
Solanki
madam.
sir, Vashne sir, Badole ma'am.
Thank you very much.
Thank you. Thank you.